Hi, let's talk about the vasculature of the upper limb. So what you're looking at here is the very well dissected axilla. And before we dive into the details of any of this, I want you to consider some of the branches off of the arch of the aorta. So the arch of the aorta is going through, and then we have the brachiocephalic artery. Then we have the left common carotid artery, and then we have the left subclavian artery. That left subclavian artery, as we move beyond the border of the first rib, becomes the axillary artery, which you're seeing through here. So the axillary artery is being transmitted through the axilla. And there are several parts to the axillary artery that we'll discuss in another section. But once we move beyond the inferior border of the teres major muscle, that axillary artery becomes the brachial artery. So brachial arm, this is the artery of the arm. Before getting to the brachial artery, that third part of the axillary artery is going to send off a couple of branches, two of which you can see here. So this would be the anterior circumflex humeral artery, and the larger of the two being transmitted more posteriorly, and this will accompany the axillary nerve, is the posterior circumflex humeral artery. Both of these arteries are going to wrap around the neck of the humerus and anastomose with one another and supply blood to the deltoid muscle. And it's this posterior circumflex humeral artery which is the lion's share of that blood flow to the deltoid. Now, before we jump off of this slide, I want you to see that after its conversion into the brachial artery, there is a branch of the brachial artery that I'm coloring in now called the deep brachial artery, sometimes called the deep artery of the arm, or the brachial profunda artery. This is going to service the posterior compartment of the arm, whereas the brachial artery and its branches will continue down through the anterior compartment of the arm, serving it. Now, let's take a look at the posterior aspect of the arm. So, coming around here is the axillary nerve and axillary artery together. They're actually being transmitted through a space called the quadrangular space. That quadrangular space has four borders. So superiorly here is teres minor. Inferiorly here is teres major. Laterally here is the edge of the humerus, and medially is the lateral edge of the long head of triceps brachii. And it's through this quadrangular space that the posterior circumflex humeral artery and the axillary nerve are able to move from the axilla to service the posterior aspect of the shoulder, namely the deltoid muscle, which we can see here. Let me erase all of this. A small eraser here. All right, we can also see coming down around with the radial nerve. So this is the radial nerve here. The deep artery of the arm, or the deep brachial artery, to service the posterior compartment of the arm. So these are wrapping around the radial groove of the humerus in this place. Now, as you can see here, I have this listed as the brachial artery and veins. There are also deep veins of the arm. It's very common for arteries to have accompanying veins. So a single accompanying vein is known as a vena comitans. If there are multiple accompanying veins, which are very common, especially in these upper limb arteries, we call them venae comitantes. So these venae comitantes, or accompanying veins, are making good use of the pulsatile nature of the arteries to help apply pressure to themselves for the return of blood back through to the heart. So the contraction of muscles, the pulsatile nature of accompanying arteries, all helps with blood flow through the veins. Now, any of these accompanying veins are just named the same as the arteries that they accompany. So, for instance, there is a brachial artery, and then there are brachial veins. There is a deep artery of the arm, and then there are deep veins of the arm. So, although veins can be highly, highly, highly variable, I want you to conceptualize that for every named artery of the upper limb here, it's very common to have venae comitantes with the same name. So let's switch back to the anterior view here, and we have the brachial artery descending down into the forearm from the arm, and around the cubital fossa, which is this area here, so that's the anterior aspect of the elbow, we're actually going to see that brachial artery and its accompanying veins split into a radial and an ulnar artery. So as we come down, let's see, the radial artery there. You can see the ulnar artery dive deep there, and it's going to be picked up on the other end of those muscles there, so you can appreciate its depth as it moves forward. If we strip away a good bit of muscle, we can still see there's our cubital fossa, there's our brachial artery, and the veins have been removed. There is the radial artery coming down, down, down. And approximately there, laterally on the wrist, would be the pulse point for the radial artery. And then we have the ulnar artery descending down. And there's going to be a branch off of the ulnar artery, approximately there, called the common interosseous artery. It will have accompanying veins, and that common interosseous artery is going to divide into an anterior interosseous artery and a posterior interosseous artery, and they will have accompanying veins. That posterior interosseous artery is going to supply the deep layer of extensors, so the deep layer of the posterior compartment of the forearm, whereas the anterior interosseous artery is going to supply the deep layer of the flexors of the arm. And actually, I'm sorry, that the posterior interosseous artery will oftentimes supply the bulk of that posterior compartment of the arm. We name these the interosseous arteries because they divide around the interosseous membrane between the radius and the ulna. Now, here we can see that continuation of the ulnar artery. And what happens is that the ulnar artery is going to supply the superficial palmar arterial arch. So let me write this here. Superficial palmar arterial arch. So that's coming from ulnar. And I think superficial has the U, ulnar. The radial artery is actually supplying a smaller arterial arch called the deep palmar arterial arch. And very frequently, these two arches are going to anastomose between the two. So we're going to have a shared blood supply to the hand and its digits from both the radial and the ulnar arteries. And it's pretty important that, that these anastomoses are present if ever you were to cannulate the radial artery. So in cannulating that artery, you can occlude the artery. And if these anastomoses are not there, a cannulation of the radial artery is going to spell trouble for blood supply to the first and sometimes second digits. So there are, good tests for these, but it's something to keep in mind. Now, veins. The major veins of the upper limb are superficial veins. Veins, as always, are hypervariable, or they are inconstant, as we would say. So let's just orient ourselves here. So here we're looking at the lateral side. This would be the radial side. And here is the medial side, the ulnar side. Right, we're looking for that thumb to establish the lateral relationship. And there are a couple of major veins at play here that we can see. So coming up here, we can see the cephalic vein. So that cephalic vein is going to ride its way up into that delta pectoral triangle there and dive deep. And medially, we have the basilic vein. You can see the basilic vein coming up here. And that basilic vein is going to join up with the vena comitantes of the brachial vein. So that's going to be deep here to form the axillary vein. One last vessel of note would be the median cubital vein. The median cubital vein is found typically in proximity to the cubital fossa, which we can see there. And this is going to be, if it's present, a delightful target for venipuncture. So if a phlebotomist is going to withdraw your blood, sometimes they look for the distension of that median cubital vein to poke. So that's our review of the vasculature of the upper limbs. I thank you for your time. Take care.